the ideal age range for someone to undergo a bear surgery is any age. Uh, I think younger people, whether we do a bear surgery, a repair, a restoration, or we do a reconstruction, make a whole new ligament, they are much, much higher risk of re-tearing, probably somewhere around 25, 26%. Like a quarter of them are going to re-tear. There's a lot of reasons why. Some of it is they do try to get back sooner than they should, and there's pressure on them to get back sooner than they should, and they take more risks, and their tissues are more loose anyway than as we get older. So it takes longer for that ACL reconstruction or repair to remodel. So the younger the person, it's still um, a little more scary. And some people would say, well, don't do a bear on them because they're at a high risk of re-tearing. Well, you're at a high risk of re-tearing if you do an ACL reconstruction as well. So I think the biggest thing that I like about the bear and the younger people is a lot of them have open growth plates. And if you do an ACL reconstruction, you're drilling about a 10 or 11 millimeter, about the size of my finger here, tunnel through the knee, through the tibia, the shin bone, and through the femur, the thigh bone. And you got to worry about damaging the growth plate. Whereas it's maybe 2 to 2.5 at the most 3 millimeters if you're using the bear technique, and so much less chance of injuring the growth plate. So I think it's ideal for younger, and it's absolutely even more ideal as patients get older. It's a lot less trauma to the knee. These patients may have some arthritis and other things like that, so avoiding a big, huge, you know, harvest site and more scar tissue and all that. And then uh, the animal studies show that if you repair the ACL, especially with bear, there's a lot less likely chance of arthritis forming down the road because arthritis, if you tear your ACL, you probably have a 50% chance of developing arthritis within 4 or 5 years. If you tear your ACL and undergo an ACL reconstruction, you still have a 50% chance of arthritis, but maybe it pushes it out 12 to 14 or 15 years. If you're 14 years old and you add 15 to that, that's 29. That's still pretty young, 50% chance of getting arthritis. So the animal studies definitively show bear has a less risk of arthritis than if you do an ACL reconstruction or leave a tear alone and don't do anything. It looks like the human studies are trending that way, but we don't have enough people 10 years out and further just yet. But when that study does come out and if that proves that there's less risk of arthritis, then again, all the more reason to do the bear than a reconstruction. So any age, I guess is what I'm saying.